Hello, my name is Dr. Kashif Abdullah, and I would like to speak to you today about chronic coughing. A chronic cough is anything that lasts more than 8 weeks, and this can affect about 40% of the population. And in order to address chronic coughing, we need to identify as best we can the causes of the chronic cough. Now, this can be caused anywhere from the mouth all the way down to the lungs, can cause a chronic cough. Primary care physicians usually coordinate care with ENTs, pulmonologists, GI doctors, allergists, immunologists, and even neurologists and speech therapists. Now, there are four major causes of chronic cough. One is drugs, the other is a postnasal drip, asthma, and or reflux. So I'll go through each one of them. All right. So obvious causes of coughing usually can be smoking, or in regards to drugs, smoking or and angiotensin converting enzymes. Basically, they're the lisinoprils, they're the benazeprils, they're the blood pressure medicines that we give, and usually this happens shortly thereafter taking the medicine. Sometimes it takes some time, but these medicines need to be stopped, and you can give what's called an ARB. That's another blood pressure medicine that's sort of like an angiotensin inhibiting medicine. So losartan is an example of this. So if you've recently gotten a blood pressure medicine from your doctor and you're starting to cough, it's likely due to that blood pressure medicine. Not all blood pressure medicine, the lisinoprils or ACE inhibitors, or lisinopril is the most common one. Another cause for chronic cough is a postnasal drip. What a postnasal drip feels like is there is fluid flowing in the back of your throat. It's usually sinus drainage into the pharynx, so the back of the throat, nasal discharge, frequent throat clearings, that kind of thing. And and people might not even know that they even have it, meaning they're having postnasal drip, but they don't even feel it. And so that's one postnasal drip, and that's another one. Another one is asthma. So people who have asthma can have chronic coughing. That's with shortness of breath, wheezing, again coughing, and then the last one is reflux or heartburn. So that's basically when the acid from the stomach goes up through the esophagus and can start irritating the nerves along the esophagus and into the windpipe as well, and you get frequent throat clearing with hoarseness. So that kind of thing, or hoarseness, or sore throat sometimes. But reflux is another reason for chronic cough. So how do you stop all of them or try to prevent them? Well, for smoking, you stop smoking. So chronic cough, smoking, you stop smoking. ACE inhibitors or the blood pressure medicines, change them or stop them. That's one. And it can sometimes take up to 4 weeks of stopping those medicines in order for the cough to go away, just to let you know. Um, you can also, for postnasal drip, this is where more of the allergies and the antihistamines come into play. So, for postnasal drip, trying to avoid allergens in your area. So it's sometimes a good idea to go to your allergist or your primary, and they can determine what allergies you're experiencing and maybe reducing those triggers, or you can take antihistamines like Claritin or corticosteroids like Flonase or fluticasone that can be sprayed into the nostril every day, and that can help stop the coughing due to postnasal drip. Asthma, you can take Advair or like asthma medicine to help alleviate the asthma so that you don't cough as much. And then for the reflux, it's changing lifestyle modifications, honestly, first. So maybe you don't agree with chocolate, or maybe tomato juices or tomato products are causing you to have reflux. So it's cutting down on that. Another one would be acid suppression medications. So famotidine or Pepsid if you live in America, or omeprazole is a very good one. That is also good, or um, Nexium with esomeprazole. So these kind of acid medicines, and your doctor can help you with each one of them. So again, just to summarize, there are chronic cough can last up to 8 weeks. Sorry, is a cough lasting more than 8 weeks and can be caused by smoking, medicines, postnasal drip, asthma, and reflux. Each one has their own individual treatments and can take time after starting those treatments. Well, that ends today's topic. Thank you very much. This is Dr. Abdullah signing out. Thanks. Bye bye.